Hello and welcome to Healthy India. I'm Lottie Alaric. Well folks, I'm back with you once again to take you on this journey of good health in the next 1 hour. Today we've picked up a health condition which is usually caused by ignorance and if not diagnosed and treated properly could also turn fatal. Yes, today we will tell you all about acute viral hepatitis. To talk about the same, I have in the studio an eminent panel of physicians. It is my privilege to welcome Dr. Mitra Basu from Inmas Hospital. Sitting to his right is Dr. Sunil Raheja from GB Pant Hospital. And to my left is Dr. Bir Singh from the All India Institute of Medical Sciences. So I take this opportunity of welcoming all of you to the show.
Thank you, Lottie.
Thank you.
Well, people, before we actually start questioning our panelists and before they start telling you about what the disease is all about and how it can be taken care of, let us take a look at this report.
Hepatitis is a general term given to any form of inflammation of the liver. Jaundice is a key symptom of all forms of hepatitis. The liver is the largest organ of the body. There are several functions that it performs day in and day out. Acute viral hepatitis is a systemic infection predominantly affecting the liver. It is most often caused by viruses that are hepatotropic, that is hepatitis A, B, C, D and E. Other viral infections may also occasionally affect the liver, such as cytomegalovirus, herpes simplex, Coxsackie virus and adenovirus. Whereas hepatitis A and E are self-limiting, infection with hepatitis C and to a lesser extent hepatitis B usually becomes chronic. Acute viral hepatitis can cause anything from a minor flu-like illness to fatal liver failure. Sometimes there are no symptoms. The severity of symptoms and speed of recovery vary considerably depending on the particular virus and on the person's response to the infection. Hepatitis A and C often cause very mild symptoms or none at all and may be unnoticed. Hepatitis B and E are more likely to produce severe symptoms. Co-infection with hepatitis B and D may make the symptoms even more severe. In most people, special treatment is not necessary, although people with unusually severe acute hepatitis may require hospitalization. After the first several days, appetite usually returns and people do not need to stay in bed. Severe restrictions of diet or activity are unnecessary and vitamin supplements are not required. Most people can safely return to work after the jaundice clears, even if their liver function test results are not quite normal.
Well, I'm sure that must have given you a fair idea about what this condition is all about, but we'll definitely simplify this for you a little further. But before we do that, I'd like to ask you, Dr. Basu, that if we were to talk about this occurrence of this disease in our country, what do the figures roughly say?
See, as far as occurrence of hepatitis is concerned in our country, though you will never get a exact picture of this thing, just because many of the cases of hepatitis, they just go unnoticed. That we call subclinical infection also. So, person gets hepatitis, but is not suffering from anything. By chance, person goes to some doctor or for some pathological test and his sample is taken. It may be like the sample shows that he was suffering from hepatitis or he had been suffering from hepatitis or still that thing is going on. So, that makes a lot of persons below that stage of our clinical significance. But as such total hepatitis cases, we can say about more than 50% of the total hepatitis cases, they are suffering, they are because of these viral infections. So, a lot of viral infections like just now what we have seen in the clip. These viral infections, they cause more than 50% of hepatitis cases as such, apart from like some metabolic disorder, some drug induced, some toxin induced, maybe some because of some opium addiction or some other addictions things, because of pregnancy and other these things. All those things, they also can cause hepatitis.
Okay.
But most of them are because of these viral infections.
All right. So, Dr. Raheja, do you have anything to add to that?
Yes, you know, the hepatitis virus infection, if you take the total world, there are more than 2 billion people, those who have been infected by the hepatitis B virus at one time or the other. And at any point of time, there are approximately more than 400 million people, those who are carrier of hepatitis B. And more than 200 million people are carrier of hepatitis C virus. And the most important point here is that hepatitis B virus, if you see 60 to 80% cases of hepatocellular carcinoma, because hepatitis B tends to be chronic and it is the major cause of hepatocellular carcinoma in 60 to 80% of the cases, as well as it is the major cause of liver transplants to the tune of 5 to 10%. And the hepatitis is more common in the young people in the Indian population as well as in Southeast Asia. Hepatitis A, it tends to occur at a younger age in the Indian population with compared to the West, where the hygienic conditions, sanitation, they are better. They are more aware of their needle prick injuries and other issues, blood transfusion and all that.
Right.
So, if you see in the Southeast Asia, India, Bangladesh and African Sahara countries, this kind of infection is more common, tends to occur early, and there is more of morbidity and it tends to get chronic hepatitis B, C and D. Whereas hepatitis A and D, it is acute illness and it is a self-limiting disease which will limit within 4 to 8 weeks and the person can be absolutely healthy.
Okay. So, Dr. Singh, I might understand that ignorance plays a very big role as far as hepatitis is concerned, whatever forms that we are talking about.
No, I think let us look at it this way. Hepatitis A, usually known as viral hepatitis A, and previously known as infectious hepatitis, and hepatitis E. These are essentially related to drinking of contaminated water, milk or contaminated food item coupled with poor personal hygiene. Right.
Okay.
Now, these are the factors which are responsible for hepatitis A and E, whereas hepatitis B and hepatitis C have got different routes of transmission.
Okay.
This particular route of orophycal route as we call it is not the main channel of infection in those hepatitis B and C.
Right.
So, yes, ignorance plays a role more in terms of hepatitis A and E because people are not able to follow the simple basic hygienic measures. Like for example, if we say that if you do not wash your hands properly after visiting the toilet or before eating food with your fingers, or if you are drinking contaminated water and not really particular about making sure that your water is safe. So, that kind of ignorance does play a very important role in transmission of hepatitis A and E.
Right.
Hepatitis B and C have got similar routes of transmission just like HIV AIDS. So mainly through contaminated blood which has been contaminated with virus of hepatitis B or C, occasionally hepatitis C, but quite often hepatitis B also spreads through sexual transmission of high risk nature. Basically, if somebody is infected with hepatitis B and another person has sex with such a person, sexual transmission can take place. Then the infection can also occur if the mother is infected with hepatitis B, the baby in the uterus during pregnancy or during childbirth can again the transmission can take place. So, these are the main differences, but yes, awareness about these diseases is the tool to prevent these diseases. We also have certain other measures like vaccines,
Right.
but I think we need to follow certain basic hygienic and these measures and we are fine.
That's right. Well, so if we were to talk about hepatitis A and E, so the causes which he just elaborated, are those the only causes or anything or any precautions can people take at least to save themselves from A and E?
See, most important thing is the basic concept of transmission of A and E is what we in our technical jargon we call it a fecal-oral transmission.
Okay.
Like infected, see these viruses they come out from a patient or from a carrier through feces, stools when the and if the food, the water or hands or any surface is infected with the fecal contamination and another person who is a healthy person and he takes that thing orally, their high the chances are very high, highly risky that he will get a transmission of hepatitis A or hepatitis E after certain like say incubation period, we say roughly around after 1 month he may get the symptoms of the hepatitis.
Right.
So, the main thing crux is कि you prevent that thing. So, break that link that once the virus is out in the environment and virus goes inside the mouth of a
That channel has to be
that
taken
channel
care
has
of.
to be broken.
Right.
The
Transmission cycle has to be broken.
Yeah.
So
right,
that
right.
channel can be broken at the proper disposal of the waste, human waste. See, there is a what we propagate as such is कि people they used to go out in the fields for
Right,
defecation
right,
and all those
right.
things. So that has to be prevented. The proper disposal of that system, that system has to take care. The government and the people as such they have to take care of that thing. And then your hygienic habits. The most important is your what we call is the hygiene of hands. See, whatever is there in the environment, it goes into the mouth through our hands. So
Right.
hand hygiene is very important in that.
Right,
Besides
right.
this, the drinking water, if you can boil a water for 1 minute, or the water can be exposed to UV radiation or chlorinated, this will kill the hepatitis A virus. Because India we have basic problem of drinking water.
Right.
If you go to small cities and villages, the people, the best way for them is to have a safe disposal of excreta, plus the water they are drinking should be either boiled or you can do UV radiation, or you can put a tablet of chlorine, and that will prevent for the transmission of hepatitis A. I mean, the water is the most common cause of transmission in the Indian population as well as all over the world.
That's right.
Whereas the standard of water are better in the Western countries and European countries, and in Indian cities also, the people, those who are in the periphery, they can use all these precautions. Beside that, they have to wash their hands whenever they take meals. And the second precaution for the person who is nursing the patient suffering from hepatitis A or E virus, they should wear gloves while disposing of their excretas and cleaning the utensils and all that, so that this is not transmitted to the other people.
So which means if a person who is suffering of either A or E and he's eaten in a certain bowl or something, and if somebody happens to share it, are there chances that the other person would also catch it?
Let's not talk about that kind of sharing.
Okay.
I think I will like to emphasize that 5 F's: fingers which are contaminated, food which is contaminated, flies taking the virus from infected material to other say for example food which is lying there. So those food, finger and flies and fomites. Fomites mean
Yeah.
inanimate objects.
Right.
Now these are the ones which can get contaminated and transmit the virus from fecal material to other sources, and then if this is taken by some so called healthy person, the virus will spread.
Okay.
But at the same time, let us also not forget the importance of those people who are not really suffering from the disease, but are carrying the virus.
Carrying the virus. Okay.
Now, they are the ones who are very big source of transmission of infection, because nobody knows whether they are infected or not, but they actually are infected.
True.
And as Dr. Raheja said some time ago, let me just correct that figure here. About 8% of Indian population, which is a large number, is actually carrying hepatitis B virus as carriers. And then you also need to know, for every 1 infection of hepatitis A, you are likely to have 10 persons who may be infected but are not showing symptoms.
That's right. Okay.
So they become subclinical infection cases or inapparent infection, and are a potential source of infection to others. But the disease like polio, like typhoid fever, like diarrheal diseases is essentially a disease of contaminated water intake, contaminated food intake,
Right.
poor
So which
personal
means I think
hygiene.
it comes to, everything comes to about personal hygiene and what kind of food people are eating. Well, at this point, we'll have to slip into a break right now, but people do come back quickly as there's still a lot more on the other side.
एक शक्ति, एक ताकत, जिसने अन्याय के आगे कभी हार नहीं मानी। जो सदैव सत्य और अहिंसा की राह पर चलता रहा। आज संपूर्ण विश्व जिसके सम्मुख नतमस्तक है, महात्मा गांधी।
Welcome back. This is Healthy India, and today we are talking about acute viral hepatitis. Well, so Dr. Basu, I'll come to you now. Now, since we are talking about hepatitis A and E, what are the kind of symptoms that a common man should be able to assess by himself or herself as to if he or she sees those kind of symptoms, at least gets up and goes to the right doctor?
Yeah, Lotte, first thing is many people, they may not have any symptom. So let us forget about
it. Is really dangerous.
They don't have any symptom, and this state we can go to a carrier stage which they can infect others. So that is one thing. So let us not talk about those people who don't have any symptom.
Right.
But yes, persons may have some symptoms as simple as just like slightly malaise or weakness and a slight headache, mild rise of fever, a distaste for cigarettes and all those things, to see this is a spectrum, it's a continuum from symptoms as low as these symptoms to as high as if like fulminant hepatitis with all sort of jaundice, change of color of stool, change of color of urine, change of color of eyes, and a severe feeling of extreme weakness and maybe some derangement of mental functions also.
Okay.
So it's a large continuum of symptoms. But generally they start with low and mild grade fever and they say, you can say the change of color of your urine and feces, and sometimes it is just noticed by a change of color of eyes, what we call is a jaundice, a slightly yellowish color of eyes.
But how does one differentiate between jaundice and hepatitis?
See, Lotte, jaundice is a symptom.
Right.
Okay.
Okay.
Hepatitis is a group of disease.
Okay.
Jaundice can be caused by so many things. It may be hepatitis causing jaundice, it may be sometimes gallstones blocking somewhere, they may be causing jaundice, it may be some other diseases, it may be some blood disorders, or it may be some like a breakdown of RBC. There are so many diseases which may have a common symptom like jaundice.
Okay.
So it may be caused by other things also, but hepatitis, yes, it may have jaundice or may not have jaundice.
Right.
So that is.
So, Dr. Raheja, if one does end up with those kind of symptoms and actually goes to a doctor, so what is the battery of tests that you would run on a person like that?
Yeah, basically, it depends on the type of hepatitis infection he has.
Okay.
Hepatitis A virus or hepatitis B virus or C or D or E. And the best way for hepatitis A is we can go for a test. B, again we can go for antigen, HBS antigen, and antibodies tests are also done.
So, when you say this, it means a blood test, or what does it really mean?
Yeah, it's a blood test for all the viral markers we do.
Okay.
For hepatitis A, B, C, and according to the reports, we can know which type of hepatitis it is.
Okay.
Whereas what we see is, as Dr. Basu has told, the symptoms can vary from asymptomatic stage, which is more common in children. And as the age grows, the symptoms will tend to occur severe. And it can be as severe as acute fulminant hepatic failure. So, if we see that, the only way to differentiate what type of hepatitis it is, the only way is to go for a battery of tests, and from that, with the history of the patient, incubation period, sign, symptom, whereas hepatitis A is acute illness, patient will have more of nausea, vomiting, headache, and hepatitis B again can lead to similar symptoms, can land up in fulminant hepatitis or can go to a chronic stage. We call chronic hepatitis once the antigen can stay in the body for more than 6 months. And the patients, they just have a complaint of myalgia, body ache, lethargy, and even hepatitis C may be the first symptom may be only that. Patient may not be aware that he had any infection of hepatitis C at all.
Okay.
The only patient comes to us with a history of malaise, body aches and all that. And of course, the friends can tell it's jaundice. Patient has yellowness of eyes and passing of yellow urine. So, if we combine all these tests, and beside that we can go for ultrasound. In the ultrasound we can see that hepatic changes, there is a hepatomegaly. On clinical examination we can see in the early stages there is a hepatitis, hepatomegaly, tender liver.
Okay, well those are the medical terms, but I like to come to you here, Dr. Singh. Now, does hepatitis manifest itself differently in different age groups, say if a child is involved or say if an old person is involved in that?
Dr. Basu has already told about the symptoms which can manifest.
Right.
But I think for our viewers, to make it very simple to understand, if someone is feeling a bit low, lethargic,
lethargic.
tired, fatigued for last few days, and also has mild grade of fever, and occasionally also having pain below the right rib cage where liver is located in the
Right,
body.
right.
These are symptoms which suggest that the person may have viral hepatitis. Seek a consultation, get the confirmation done through a simple blood test, what we usually call as liver function test,
Right.
which might show raised enzymes, which are liver enzymes, and that will be the earliest kind of indicator that we have in front of us that the person may be having a viral hepatitis. Which type of viral hepatitis? That will be decided by the markers, which are other tests
Right.
which have been done. In children, yes, again the same symptoms can arise. The child is not eating well, child is listless, does not want to go to school, and is simply not looking usual self, playful or cheerful, and also has fever, also complaints of nausea, vomiting, pain in the center of the abdomen is another symptom which also indicates in certain situations, if it is lasting for a few days, please look for hepatitis.
Okay, well, I'm so glad that you mentioned that, especially this lethargy and all that, because usually people think, that maybe the BP is low or something and they'll have some sugar or a cup of coffee and all that and think that they would be all right after that.
And let me also make one point clear here for everyone to understand. Hepatitis of this viral hepatitis essentially can affect all age groups, all males, females, no discrimination, but yes, viral hepatitis A and E are essentially diseases of those places where there is a lot of overcrowding, people are living in unhygienic conditions like slums, where there is no proper sewage disposal facility, the water supply is not really guarded and not safe. These are the situations where this disease occurs more, though it does not spare anyone, I repeat, not the rich also for that matter.
That's right. So, Dr. Basu, if someone, as we just take this as an example, if someone is infected with A or E and those tests have been done and it is established that this person is suffering, so what does the treatment really entail?
Yeah. See, there are no specific medicine for recovery.
Okay.
So it is usually not given. Unless the viral count is very high or there are some complications and somebody has to take some antiviral medicines, unless this is very rare thing to. But usually most of the people, they don't require any specific medicine to counter the hepatitis virus.
Okay.
Most of the people. So we can take it as a rule of thumb.
It's a self-limiting disease.
It's a self-limiting disease.
Most of the time.
And but only thing is supportive therapy. Some golden rules one should know. One of the rules is you take adequate rest.
Bed rest, yes.
Bed
Okay.
rest. See, more rest a person takes, more blood will be available for the healing of liver to liver. So the total healthy blood should go to the liver to heal it. So the more blood is available, so healing will be much better. So one thing is rest. Second thing is diet. See, there may be some restrictions, there may not be some, but thing is again less of fats, maybe it will be easily digestible food.
Right.
And simple foods like simple fruits, vegetables, then some liquid diet, and that is the second part. So diet should be simple. You should not be having a lot of additives and masalas and outside food. That should be avoided as a care of a sick patient.
Right. And what about a person who may also be alcoholic at the same time? So what are the precautions
That is a big no to alcohol. See, alcohol directly attacks liver.
Right.
So even if a person is taking a moderate amount or a mild amount of alcohol, ultimately it is to be detoxified by liver. So there is a sparring between liver and alcohol whenever alcohol enters. So liver is our defense mechanism is already down. So over and above, if any type of medicine also, and alcohol is one of those medical compounds, if it is entered into the system, the total load goes to the liver. So it can further, and I should not say can, it further damages liver if the person is suffering from.
Okay. So are there any complications that can arise any time for a person who may be suffering of A and E, Dr. Raheja?
Yeah, normally the hepatitis A, it's a self-limiting disease. All you need is a good sportive care, rest, balanced, nutritious, easily digestible diet. Okay. And there is nothing to panic, but in certain cases it can like in adults, if the symptoms are severe, patient is having lot of nausea, vomiting and dehydration. In only in those cases patient can be admitted and given some IV fluids. The hydration should be maintained, but there are studies the patient those who take a good balanced diet rich in calories more than 2000 in a day, like those the patient those who keep eating well, they always recover early and do well. Whereas hepatitis C can tend to occur severe, particularly during pregnancy. The patient can land up in the fulminant hepatic failure, and mortality in hepatitis C with pregnancy can be as high as 45%. So, only in these patients we have to take care, admit the patients if the person is pregnant, hepatitis C, and take proper care of the patient to prevent further complications.
Okay. So, Dr. Singh, does if there is a pregnant woman and who unfortunately develops A or E, is there any danger to her or to the baby?
Such a woman can actually have complications in pregnancy. The pregnancy can terminate itself in terms of an abortion or a premature delivery, or even at times it can cause stillbirth. Basically, the baby is born dead.
Right.
And then the entire scenario becomes very difficult. Generally, the pregnancy becomes difficult if the infection has taken place during this. And as was mentioned, hepatitis E occurring in pregnancy can acquire serious form rather suddenly.
Okay.
So, one has to be very careful in such situations. But as part of the treatment, I think I must emphasize here, follow your qualified doctor's advice, but at the same time just refrain from going to these jhad fooks and those tona totka, because this does not help in treatment.
That's right.
Let's be very clear, because many a time we will find in our country that people go and take some
Jhad
fook from someone who says that pilia or the jaundice will be treated. No, not at all correct. Better to waste your time and energy on a consultation with a qualified doctor. Follow the advice and you will be fine in most of the times.
Right. Well, people, I do hope that you will definitely carry this message home, that it is not the jhad phuk wala who has the treatment at his hand, it is only the right doctor. So, do keep that in mind. Well, right now we will slip into another break, but do come back quickly as there is still a lot more on the other side.
सड़कों पर चलते रिक्शे से भारत के नक्शे को नापता हुआ आम इंसान, रोजी की रस्सी पर चलकर देश की सत्ता को साधता हुआ आम इंसान, हर मुद्दे का हिस्सा होते हुए भी उसकी खबर रह जाती है आम। आपसे जुड़ा मुद्दा अब होगा खास। सिर्फ लोकसभा टेलीविजन पर हर रविवार शाम 7 बजे विशेष आम इंसान से जुड़ी खास पेशकश।
Welcome back. This is Healthy India, and today we are talking about acute viral hepatitis. So, Dr. Basu, now as we are talking about the treatment part and how it can be taken care of, as you said, liquid diets and all that. But what about these things which are available outside, you know, the sugarcane juice or the other juices and all that, and people think that, okay, once they have juice, they'll be fine. So, is there anything specific that you would like to tell the viewers today?
See, juices are okay as far as they are clean. But only problem with this thing, see, I would like to mention here is many persons suffering from hepatitis may suffer from low blood sugar levels.
Okay.
So, they may have that urge of taking a lot of sweets or sweets. It's good, okay, they should take. But once upon a time, maybe this sugarcane juice was the only available medium to give sugar in a dissolved form to a person. So, this is more so a tradition, more so a ritual now, rather than a part of the treatment.
Okay.
But one should understand the other complications involved with such juices. See, if the juice is extracted outside, sugarcane juice cannot be extracted in your house. So, you have to take help of some vendor or some shopkeeper selling it. Now, I don't want to mention all those things of hygiene involved and infections involved. So, it's better to refrain from any processed or any prepared food from outside. Your own kitchen is the best. You see, even if it is juice has to be given to a person, okay, it is fine. There is no contraindication. It can be given. Then it can be taken out in your own home.
Right.
So, all those juices which you can prepare I don't think there is any harm to that thing, but all those juices which you have to bring from outside, because he is a patient. So just refrain him from taking all those things. That is what I would like to say about these juices.
All right. Dr. Singh, you want to add something here?
Sugarcane juice which is sold generally outside, you will find that vendors do not follow hygienic measures. Their glasses are dirty, their machine is dirty, they do not wash the sugarcane. In fact, let me tell the viewers, sugarcane juice can become a source of infection to general population if the hygienic measures have not been taken care of by the vendor. So please take sugarcane juice if you can ensure that it is prepared absolutely hygienically. Otherwise, say a big no to juice like this which is sold outside and vendors are not taking hygienic measures.
Right. And so, Dr. Raheja, anything specific about the diet that you would like to mention, that what is it that people must eat and what is it that they must avoid, if there is anything that should be avoided?
Yeah, basically in the diet, as we already discussed, the person, those who take balanced diet like juices and light, easily digestible, khichdi, dalia, dal, aloo ka sabji, the light diet, the person can take it easily. It is palatable, because what happens during hepatitis is there is a loss of appetite, nausea, vomiting, and there is a change of taste also at times. So, what we have to make sure that the person is eating adequately, the diet is light in nature, easily digestible, nutritious, and that will serve the purpose. Whereas, a good standard of hygiene should be maintained, as we have talked about the sugarcane juice and all that market things should be avoided. Beside that, the person can take plenty of liquids to maintain the hydration. And since the blood sugar tends to fall, the diet which is rich in carbohydrates and proteins, the patient, those who take all this kind of diet, like aloo and all that, nutritious diet, they always recover well. They have a better recovery than those who are not taking the diet, or those who are repulsion to food, because during hepatitis there is a loss of appetite and the patient does not like to eat well. So, it is the duty of the home people or the attendant to make sure that the person is eating well and maintaining that calories and energy intake to counter the infection and recover well.
Right. Now, Dr. Basu, if we were to talk about hepatitis B and C, first, how would you like to explain this to us as to what do B and C really mean and how do they manifest themselves?
Lottie, on one side, when hepatitis A or E, they are can be transmitted through fecal-oral contamination of food and other things what we discussed now. Hepatitis B and C and D as a part of B in some cases, they usually were called as serum hepatitis once upon a time, because they were found to be transmitted by infected serum. So, now we can understand. So, the simple logical understanding is so they are present in the serum, they are present in your body fluids, maybe they are present in sexual secretions, sometimes may be present in tears or maybe present in blood, or maybe on some other mucosal secretion, maybe some nasal secretions they are present. So, we can think of all those things infected a person through infected needles, through infected blood and through syringes. Sometimes these drug addicts, they
share syringes.
Then sexual transmission, just like AIDS we think
unprotected
of.
Sex.
And in many cases, even Lottie, the use of, can you imagine this, your nasal, some sprays or these things are available. If person is suffering from such hepatitis and using
the same.
So, in drug addicts, it has been found using nasal routes, the same thing, it was a medium of transmission of such thing. But primarily, they are transmitted through infected serum, blood, or through sexual transmission. They are the primary mode of it. And yes, one more thing, pregnancy. If mother is suffering from hepatitis B infection and she is positive during the pregnancy, at the time of birth, when the child is being born, maybe during the time of the conception he was not suffering from hepatitis, but at the time of birth, the child gets into direct contact with maternal blood.
So that can, I'm sure,
and that is the chief reason of transmission from mother to child at the time of birth, hepatitis B. And unfortunately, in neonates, newly born infants, more than 90 or 95% of these newly born infants, if they contract hepatitis B during birth from the mother, they go into a chronic long chronic hepatitis.
So those are the cases of
95% of
hepatitis.
the neonates.
Okay. So for hepatitis B and C, Dr. Raheja, what are the symptoms that one can look for if these two other hepatitis B that a person is suffering?
Yeah, hepatitis B and C. The person may be just coming to you just with history of myalgia, body ache, lethargy.
Okay, the same
it can
as
be
in
a very
A and
mild
B.
symptom.
Okay.
Or in hepatitis B, the symptoms can be very severe also. Nausea, vomiting, fever, arthralgia, pain in the joints. And it can lead to the permanent FHP, permanent hepatic failure also. And all these symptoms can vary from a mild spectrum to a very huge thing, and can be life threatening also. And hepatitis B tends to be a chronic hepatitis. And as Dr. Basu has told, there is a vertical transmission during pregnancy at the time of delivery. So the best thing for us is we must check the blood of the mother during pregnancy for hepatitis B.
Okay.
And if the mother happens to be positive for hepatitis B, it is the duty of the physician or the treating doctor to give immunoglobulin B to the newborn child immediately within first 12 hours, as well as the child must also be vaccinated for hepatitis B, and that is also a part of our national immunization program these days. So this can reduce the incidence of vertical transmission of hepatitis B in the newborn from the mother.
Okay. So, are there any complications that you have really come across as far as B and E are concerned? If somebody is suffering, are they at a risk of any kind of complications?
No, one important complication is the failure of liver function.
Okay.
Liver failure as we call it, and that is what
altogether.
was mentioned, acute liver failure.
Right, right.
When we are repeatedly mentioning it that the liver failure can occur, it basically means that the functioning of liver deteriorates very fast and the person can slip into certain complications like coma, can throw convulsions and simply vanish off very quickly. So that is the biggest threat. But more importantly, before that one can happen, as initially was mentioned, hepatic and liver carcinoma, liver cancer can occur in such patients who are carriers of hepatitis B and C, and then itself becomes fatal in many cases. I think if you have to talk in terms of hepatitis B and hepatitis C, I would simply suggest that if you remember how HIV/AIDS occurs and how HIV/AIDS can be prevented, the same rules apply here also.
Okay.
The transmission is similar,
True.
prevention methods are similar, and of course there are other additional things in hepatitis B for management, because those patients who become chronic carriers, gastroenterologists or liver specialists, they put them on certain drugs which are very expensive, which are obviously not affordable by everyone, but we do have some treatment. Dr. Vasu can throw more light on that.
All right. So, over to Dr. Vasu.
Yeah, this one thing I would like to mention here is sweat is okay.
All right.
Coming into the contact of sweat of a patient is okay, because sweat doesn't contain these this thing. And as far as treatment is concerned and complications are concerned, one of the important complication is later on what we call a sequelae is cirrhosis of liver.
Okay.
See, we have heard of alcohol causing cirrhosis. You see, the person is alcoholic and later on he developed some liver complication, liver became stone hard and he passed away. The stone hard liver is what we call a cirrhosis in our medical terms. Similar thing can be caused by hepatitis B infection later on. So this is very important complication. So the liver just gets converted into a very hard substance, regeneration, degeneration process, and it gets deformed, the liver functions goes, it just shrinks, all the blood vessels going through it. It leads to back pressure in arteries, there are some hemorrhoids and all those problems, and ultimately it's failure. And it's very unfortunate for a person to have liver cirrhosis. A lot of liver transplantation and all those things are done because of liver cirrhosis.
Right.
This is again a complication of a simple hepatitis, one of the later complications.
True.
Fortunately, liver cell carcinoma is not very difficult to treat. It is a treatable now. There are some radiation, drugs, and then some liver transplantation and all those things. This liver carcinoma, but again it is a cancer, which later on one gets.
All right. Well, we'll talk about the prevention and we'll definitely talk about the treatment, but all that will come after this short break. So people don't go away, as we'll be back in just a moment.
Our
Are men from Mars?
And women from Venus?
Who is the better half?
Who takes the decisions?
Who is responsible?
Who is demanding?
Who is submissive?
Who is independent?
Can men and women ever find common ground? To find out, watch Gender Discourse. Every Thursday, 4 p.m. only on Lok Sabha Television. Welcome back. This is Healthy India, and today we are telling you all about acute viral hepatitis. We've told you as to how the disease manifests itself and what are the symptoms that emerge. Now we will tell you as to how to treat this, as most of it is preventable. So the first thing, people, that you need to remember is that in this case, prevention is definitely better than cure. So Dr. Raheja, let me start with you now. When we talk of the preventive measures, is there anything specific in addition to all that you've just said that people must really know about?
Yes, as far as hepatitis B, C and D is concerned, prevention is only, it spreads to the blood and serum. So the best thing is to avoid that it can spread through the cuts, needle stick injuries, and people, those who are drug addicts, and then those who have sex, unprotected sex with the person who has infection. The persons using razors, even it can spread through razors at the barber shop if it is not really sort of maintaining a proper hygiene, and the persons can get transmitted through that also. And even in pregnant women we have to take care, and accordingly we have to see all, basically the hepatitis B, C, D, it spreads through the serum, and A is a waterborne and fecal-oral route. So more important is, since this is a disease which can be easily preventable by maintaining a lifestyle, good lifestyle, by maintaining good hygiene, sanitation, and preventing unwanted needle pricks. And even if you get a needle prick by chance, it is very important that you go to a proper physician, hospital, because there is a way of prevention by giving immunoglobulin stat. We give 3 injections, and if the person is not vaccinated, can be vaccinated for hepatitis B vaccine also, because there are vaccines available. For hepatitis A, we have got the vaccine. It can be given at 0 month and 6 month, 2 intervals, and there is a second regime which can give for a faster protection from 0, 1 and 6, and these injections of hepatitis A vaccine, which is easily available in the market, can protect a person to the tune of more than 95% at the end of 4 weeks. Similarly, for hepatitis B, the vaccine is given at 0, 1 and 6 months. It is a recombinant vaccine which is very safe, and even now it is given as a national immunization program in the extended national program at 0, 1, 6 months, even after birth. So we should take that vaccine, because taking hepatitis B vaccine is the best way to prevent yourself from this deadly disease in the long run.
Now, Dr. Singh, we have been talking about water. So, and I would definitely want you to emphasize a little more as to how should one treat one's water and how careful can one be?
I think I'll first complete the prevention of hepatitis B. Vaccination program for the country says, if the child is born in an institute or a facility, immediately give 1 dose at birth for hepatitis B vaccine, just like you give it for polio. And then at 6 weeks of age, at 10 weeks of age, at 14 weeks of age, you repeat hepatitis B vaccine injection dose for this baby. For adults, those who have not got the infection as yet and are not yet protected, adults can also be given this vaccine by the same regimen, but the dosage is, once you give today, you take another dose after 1 month, and then 6 months after the first dose, you take the 3rd dose, and you will be protected for almost life. That is hepatitis B. There is also a vaccine available against hepatitis A, but that is not part of the national program, and that can be available commercially. On your doctor's advice, you can ask, and maybe if you wish, you can take that vaccine. That also is available against hepatitis A. Hepatitis B prevention basically involves all those things which Dr. Raheja has mentioned, but I would like to emphasize, make sure that the blood anybody gets for anything like transfusion during an operation or after an accident, etc. Make sure that the blood has been tested for HIV, and ask your doctor that whether the blood has also been tested for other diseases like hepatitis B, hepatitis C, etc. That is one. At the same time, one has to refrain from having unprotected sex, because sexual transmission is another route. Then mother to child transmission, yes, that can also be taken care of. Avoid unnecessary injections, avoid tattooing on the body with the dirty instruments which people normally use.
Yeah.
So, and such things, if you take care, hepatitis B and C can be prevented. But for hepatitis A and E, which are essentially transmitted through contaminated food, contaminated water and milk, etc., you have to ensure basic personal hygiene. And let me start right from nursery education onwards. Keep your nails short, keep your visit the toilet, and immediately after that wash your hands with soap and water, and make it a rule, always wash your hands with soap and water before you eat anything with your fingers. Whenever you are traveling and coming back home, your hands are touching almost all surfaces, door knobs, bus railings, etc., etc. As soon as you reach home or reach your office, again wash your hands properly with soap and water, or maybe some disinfectant. And it is a good idea to have hand sanitizers in the offices or even at home. Make it a habit that no finger should touch your mouth unless they have been washed properly, and your food and water are safe. For water, let me emphasize here, purification of water at the home level, domestic level, boiling is the best method. You may have all kind of purifiers and I don't want to name them, but I think boiling is the best. And for boiling, the rule is very simple. Once the water starts boiling, please boil at least for 10 minutes.
10 minutes, that's right. Right.
If possible, even 15 minutes will be fine, but 10 minutes is a must. And then only you cool it and drink it. Make these habits and you should be fine. Proper disposal of latrine for slum dwellers is a must, because open air defecation promotes all these diseases, not only just hepatitis but also typhoid, worms, poliomyelitis. If one can take care of these things, all these diseases can be prevented at the same time.
True. So finally, Dr. Basu, can you tell us a little bit about the cost factor? When somebody does unfortunately have this hepatitis A, B, C or E, what is the cost really of the treatment?
See, again, once upon a time we talked about the cost factor of treatment of a heart disease patient. So I remember what I told that time was cost of prevention of say 1,000 persons. The cost of prevention of 1,000 persons, there is a cost of treatment of one patient. Similarly, the cost of prevention of hepatitis will be negligible when the cost of treatment of, see, one is direct cost, one is indirect cost. Direct cost is cost of the hospital, the doctor's fees, the medications. Then indirect cost will be he is losing his employment, that thing. Then there are 2, 3, 4 persons who are attached to that thing, they will be also losing their employment, and that is a cascade phenomenon. So think of. So best thing what I like to give the signal is, we should not think of the cost of treatment, we should think of reduction of the cost of treatment through prevention. So we can prevent thousands of the persons in the same cost.
Right. So Dr. Raheja, finally, would you like to give some tips to the viewers who are watching today?
Yes, I would like to say that the prevention is the best way, because if you can prevent the disease, you can not even prevent your suffering as well as your manpower, daily manpower, and the cost of medicine, which may be very high in the treatment of hepatitis B and C, because we have to give interferon for 6 months, and we have to give antibiotics and Ticabir and Lamivudine, which are very expensive, and even they may not be able to really get rid of the disease. So the best way for all of us is to have our vaccination for hepatitis B immediately, and for that, those who have done it very well, they can check for the antibody. If it is more than 10, they are safe, and for those who have not taken it, they should immediately take the vaccination for hepatitis B. And as far as hepatitis A is concerned, hepatitis A vaccination is more important in children, because hepatitis A is mostly common in children, and by the adult, we see that more than 90% of the Indian population, it has a subclinical infection and develops immunity. So prevention is the key to success.
All right. Well, in hepatitis, definitely prevention is the key to success. But at this point, let's give you a recap of all that we've discussed so far.
Symptoms. Symptoms range from none to very severe. Poor appetite, nausea, vomiting, fever, pain in the upper right abdomen, jaundice. Diagnosis. Physical examination, blood test, biopsy in certain cases. Prevention. Washing hands thoroughly before handling food. Not sharing needles to inject drugs. Not sharing toothbrushes, razors or other items that could get blood on them. Practicing safe sex using barrier protection such as a condom. Limiting the number of sex partners. Not sharing needles. Screening blood before transfusion. Vaccines. Vaccines given by injection into muscle are available to prevent hepatitis A, B and E infections. The hepatitis A vaccine is recommended for all children and adults likely to be exposed to the virus. Hepatitis B vaccine is recommended for everyone. Hepatitis E vaccine, a new vaccine, will most likely be used in endemic areas.
Well, that was a gist of all that we just discussed, and if you keep those points in mind, I'm sure you'll be fine, as Dr. Singh has been saying time and again. Well, let me thank you, all three of you, for coming today and for talking about this disease with me as well as with my viewers.
Thank you.
Thank you.
Well, people, do keep writing into us. Do keep telling us as to what more you'd like to see on Healthy India. For that, you need to know my address, which is
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com and our toll-free number is 1800115314.
Well, that's all we have for you in this edition of Healthy India. Do join me next week when we'll be talking about another health condition with another set of experts. Till then, this is Lottie Alaric saying goodbye and take very good care of your health.
Hello and very warm welcome to this edition of Public Forum. I'm Shalini.